You know, as we age, the delicate skin in the neck begins to wrinkle and sag a little bit, creating what some refer to as jowls or a waddle. Many patients are looking for ways to combat this problem. You know, the famed screenwriter Nora Ephron even wrote her named memoir about growing older, I Feel Bad About My Neck. So today, we're getting an opportunity to chat one-on-one with one of the most esteemed physicians in the field about a revolutionary treatment that tightens the skin around the face and the neck. Dr. Deborah Sarnoff, the Director of Dermatologic Surgery at Cosmetique Dermatology, Laser and Plastic Surgery in New York, is a world-renowned cosmetic dermatologist. And she's with us here today to talk about the SideLase 800 face and neck treatment, a smart lipo triplex product from Cynosure. Welcome to Aesthetic TV. Dr. Sarnoff, thank you so much for being here.
Thanks for having me, Brenda.
Well, I am really excited to talk about this because I know this is a problem that probably affects everybody, but why do we start getting the wrinkles and under here around our face and neck, and what is this?
It's part of life.
Okay.
What happens when we're younger, we have a beautiful triangular face. As we get older, we get the trapezoid. The cheek pads that used to be up here drift down.
Oh.
We get boxy, we get the jowls, our skin gets thinner, we lose collagen, and not only do we collect this fat, that's the turkey waddle, but we also start to get very thin skin, and it gets slacker. It's just not firm the way it was when we were younger.
Well, does it affect everybody, or maybe some of it's genetic? I mean, it might affect all of us at some point, but is some of that genetic?
Some is genetic.
Right.
Some is just chronological aging. Usually people over 40 are going to have it to a degree. And you know, when we're young, we have a beautiful angle. It's called the cervical mental angle. And think of a swan, beautiful angle.
Yes.
As we get older, we start getting more turkey-like because that angle gets blunted, and it's no longer 105 degrees, it's 180 degrees, a straight line. That's when you really need to do something.
That's right. So, which brings us to the SideLase 800. Tell us about this incredible SideLase and how it will change somebody's life who's maybe affected with this.
Well, I think it's really terrific because, you know, not everybody wants to go under the knife.
That's right.
People don't have the time. Many people just don't want to take off that time from work. And it's surgery. It's invasive surgery.
And it's scary. You say surgery, it's scary, and they might not be physically healthy enough. Maybe they have things and they can't, you know, go under the knife.
Absolutely. So what's amazing, this would be considered, quote, minimally invasive. How minimal? A tiny little opening here, like a little teeny hole here. Teeny hole.
You hide them back here. You hide them.
And enter the fiber optic. This is the SideLase. This is the laser, the tip.
Look at that.
Very tiny.
Oh my goodness.
800 microns, very tiny. And what happens when we use the laser is the tip heats up, it melts the fat, but the unique thing about the side fire of this laser is that it not only heats up straight, but it can heat up either up or down, depending on how the physician uses it.
Wow.
And what you want to do is turn it in the down direction when you're deep in the fat to optimally melt that turkey waddle, and then turn it up when you're just under the skin to take advantage of the fact that the heat can actually tighten skin.
Wow.
How does it do that? The heat stimulates collagen to be formed. And when you have more collagen, you have firmer skin.
That's right.
So,
but the fat doesn't get heavy in there? Like you melt the fat and it's not just like blop?
Well, that's what we always used to be afraid of. Taking patients over 40 and not doing the facelift, but just removing the fat would be almost like letting the air out of a balloon. But with the SideLase, the trick is because you have the side firing fiber, you can heat up the undersurface of the skin. So to a large degree, you can get tissue tightening in addition to a recontouring.
That's incredible. Now, you don't put all of this in their face, do you? This whole wire, do you?
No, there's actually a little cannula that delivers it, and it maybe goes up to there. And it's done under local anesthetic. You don't have to go to sleep for this at all. And the incredible thing to me as well is that in 1 week you barely have bruising because the beam of light actually seals off the blood vessels.
And you said that you wear a little piece?
Chin strap, kind of, for about 3 days is what I tell my patients.
24 hours, 48
when possible, and then maybe after that about 2 weeks when they go to sleep at night.
But you can go to work, you can, you know, it's not like going under the knife in major surgery.
Absolutely.
And it's very effective, which is the most important thing.
Well, I think that if you choose the candidates wisely, we're talking about people that still have some elasticity to their neck.
Right.
And they have realistic expectations. It's not a facelift,
right,
but it sure is really nice.
So when can patients expect to see results?
Well, I think the really amazing thing is when they come back at 1 week, you actually can predict who's going to do really well because you get a taste of what it's going to be like. But with that said, things keep improving.
Right.
And usually the skin will actually thicken up. And I'd say at about 3 months to 6 months, you really do see what will be. So it keeps kind of getting better, which is really nice.
Your neck is changing and rejuvenating even 3-6 months after the procedure.
Yes, and you see a more defined, sculpted jawline.
And you found people are very happy with this.
Very high level of patient satisfaction. We did a study, and actually it was about 94% patient satisfaction. So that's
94%?
Really yes, out of 24 patients were in the study.
Well, I love that, and like
really
you said,
nice.
I mean, you've got to choose the patients.
But I forgot to tell you that the average age in the study was 56.
Okay.
So to me, it's unprecedented that people that are in their 50s, we had patients in their 60s as an alternative to the knife that I had never seen before. Because we can really make people look quite nice if you're in your 20s or your 30s and you just have a little bit of extra fat in the neck. But to see that tissue tightening at the same time was pretty dramatic.
So in talking about patients and how happy they were with this procedure and how effective it was, why don't we take a look at some of the photos that you brought and see for ourselves?
Great. So what I have to tell you is this woman is over 60, and you can just see on the jawline,
yes,
the jowl has really smoothed out.
Yes.
And even though we've really just worked on the neck, that tightening actually can make the jowl flatten like that. So she has a much nicer contour of her
unbelievable
the side of her face, of her mandible.
I'm sure she feels so much younger too.
She
and
does.
tell us about this picture.
And this woman, you can see she has a rather defined waddle, what we call the turkey
waddle,
neck
right,
waddle.
right.
And you can see how she's also 60, and you can see how that's smoothed out.
Does that seem to be your average, is 60?
Well, it was 56 in the study. These were all women that I selected.
Right.
We had men in the study too, but I selected older because I really wanted to see if the side lays would tighten.
And tell us about this photo.
I think this is one of my biggest successes. This woman is really thrilled because she really now has a more defined jawline. It used to really be an obtuse angle, really no defined mandible at all, jawline, and now you can see her jawline. And even though, yes, she's in her late 50s, there is a little bit of laxity of the skin there. We might be able to improve upon it with other techniques like radio frequency, things that also don't have downtime, but we can actually heat up over the skin, which we intend to do now that the study is over.
So let me ask you this, a quick question as well. In watching and seeing these photos of the dramatic before and after, really dramatic, I mean, you can see incredible results. This is truly effective and it works. Can you, like the woman we were just looking at, she did it, and it's been, what, 6 months, a year, a couple years. Can you redo it, the skin that's left with the SideLase 800? Can you go back in?
So that's an interesting question. We ended our study after 6 months.
Okay.
So we're probably going to wait a year. And for people that might still have residual fat, it's something to think about.
Right.
So even, people with a little bit of residual skin, we might think about doing it, just treating the undersurface of the skin.
In that one particular area.
Exactly.
Okay, and this picture?
I think she also has a very lovely result, much more defined jawline on the profile. And also when you look at these people head on, the frontal view, a much thinner neck. They go out, they buy a nice necklace. They're all feeling really happy.
They must just look so much younger. So do you do the 3 points on everybody?
Sometimes yes, and sometimes actually you can access, on a smaller person, you can actually access everything you need from just one little opening here.
Okay, so it just depends on the severity and the patient.
And it differs from, liposuction because you're not actually sucking any fat out, which can be a negative pressure that can cause quite a bit of bruising. This is just, once the fat is melted, we actually just kind of roll it out just manually by pushing. It comes out the little hole.
Oh, come on.
Yeah, liquefied. Just think
cooking because it's melted.
It's melted.
It's like oil, like
just
grease.
Get it out and then just wear that trap. Yeah.
That's incredible.
I know.
Okay, I know. Okay, we got to move on to this picture. Wow, look at that result. Now, did she also lose weight? It looks like she's thinner.
No, they all feel that way.
It looks like she's lost weight.
Sometimes they get a spring in their step and they get motivated to actually lose a little bit of weight, but no, she did not. And this was almost a year follow-up on this patient. She has a little bit of thicker skin. If you have a little thicker skin, you actually can tighten even more.
Right, because you said it gives you more collagen, which then thickens the skin, so you can see the results here. Incredible. Okay, now this
he's
gentleman.
He's younger. He was in his 40s.
Okay.
And he's also thrilled with his result.
Now, do people have this jowl or waddle, as we call it, if they are excessively maybe overweight? Are they candidates as well?
That can be one factor, but you know, as we get older, fat redistributes.
Right.
And many people you look at a lot of men, and that's one of the first telltale signs of getting older, is they do start to get that double chin.
Okay.
So, but sometimes if you're very obese, it's going to be there too, but I wouldn't consider that my best candidate.
Okay.
I think it's more people that are normal weight that just have this extra problem.
Well, these are amazing results, Dr. Sarnoff. You are so talented.
Well, thank you. But you know, it takes a good doctor.
That's right.
And I think it also takes the right tool, the right toolbox, and I think the SideLays 800 is the perfect tool to accomplish these results.
Clearly, we saw some amazing results. And if you're interested in learning more about the SideLays 800 from Cynosure, use the physician finder on aesthetichtv.com to locate a doctor in your area. Thanks for joining us again on Aesthetic TV, where we keep you looking and feeling your best.